Hi, welcome and thank you for looking at this video. This video is a short overview of the webinar that we held about the Haven Pharmacy app platform. My name is Desmond Byrne and I'm responsible for customer support at RX Digital Suite. First thing I'm going to talk about mobile health app adoption. So far, smartphones, connected medical accessories and apps have been largely underutilized by the healthcare industry. But in 2016, that began to change. Primary care and chronic disease management were leading the way. Doctors were sending patients with chronic conditions home with connected pacemakers, ECG monitors, glucose trackers, and other remote monitoring devices. This move toward handheld medicine occurred largely thanks to advances in smartphone technology and ubiquitous broadband 3G and 4G network connectivity. In Ireland last year, we even saw health insurance companies roll out physician visits via video apps. And more recently, Unpost is testing a similar service, which is basically remote diagnostic via a physician type mobile app. The larger chains have invested significantly in technology over the last number of years, and already we have seen Lloyd's, Boots and CarePlus introduce mobile apps into the Irish market. And a good example of what's going to happen in Ireland is Walgreens, which is a competitor of Boots in the United States. So they introduced their app a couple of years ago, and right now that app takes in a repeat prescription every single second. And to give you a sense of what that means, 1 script per second corresponds to roughly 72 scripts per store per week. And the Walgreens president, a guy called Alex Gourlay, he outlined the 3 pillars of their strategy. First, a good location. 2, and this is a technology, the data they get from transactions. And 3, the mobile app. The app content and the development direction is completely controlled by Haven members. Our intention is that we work in a partnership approach to actually develop the app over a period of a number of years to make it the ultimate tool for your pharmacy. The app is available for free from the Apple App Store and Google Play, so it's available on both Apple and Android devices. What does each pharmacy get if you were to sign up and use the app? Firstly, your pharmacy, your store will be on the Haven Pharmacy mobile app. That's the first thing. When a patient downloads the app, they get to select a pharmacy location on app download. So for example, they would select Haven Pharmacy, Fahey's in Tullamore. The app content is specific to your pharmacy. So pharmacist, contact details, your Facebook page, all of your services, all of those are set up and defined by you, and they actually appear in the app itself. In addition to the app, you get a pharmacy portal, and your patients are specific to your pharmacy. So in the pharmacy portal, you can receive scripts and repeat scripts from your patients. You can remind your patients about repeats. You can send private messages to individual patients, and you can send marketing messages to only your patients who have downloaded the app. So for example, if Haven's Pharmacy Fahey's in Tullamore send out a marketing message, then only the patients who have selected Haven Pharmacy Fahey's will actually receive that particular push message. Marketing the app is important. Patients have to understand that the app even exists. They also have to understand the value proposition. And we work through a marketing plan with you to get the app into the hands of patients. It's a 3-phase plan. Phase 1 is more personal, one-on-one. Patient comes in, you tell them about the app, get them to download it, make sure you're comfortable with their workflow, everything's operating smoothly. Phase 2 is about in-store marketing, and we give you all the support materials for that. So we give you things like point-of-sale rack cards, PDF items you can print off in store, We give you video, QR codes, QR tags, so a lot of different materials that you use in store. And then lastly, there's phase 3, which mainly concentrates on the actual digital promotion of the app. And increasingly, we find that that digital promotion actually overlaps with promoting your business as a whole. It could be to new demographics, or it could be to new categories of patients or new therapeutic categories. That particular digital marketing plan, we work through it with you, and indeed we create assets for that as well. So there's branded videos, there's some Facebook advertising items, stuff for YouTube, and other digital marketing assets that we bring to bear. The development roadmap will be driven by the members. Initially, we are suggesting an app branded for Haven Pharmacy, incorporating your design guidelines that includes features such as repeat prescriptions, dose reminders, messages, and information. It has already brought to our attention that we should later on in the year include things like Haven Top 5 and some healthcare information. That's something that we intend to do, again, based on your feedback later on in the year. And then in 2018, we'll agree a series of features that you guys want to incorporate. Priorities will be driven by you, and then we'll develop the app accordingly. Type of benefits that you can see. We expect there to be thousands of downloads, that you will have about 10% of your total script volume coming from the app. You could see an improvement in repeat revenue because of the way that's been managed, and you'll definitely have hours saved. I mean, one of the big things that we've seen in the workflows in Ireland is that the app enables you to reduce the peaks and troughs in your business, that you can pre-prepare scripts in advance so that you can actually be prepared for busy times, therefore for improving your workflow and throughput and helping patients. The app itself has excellent communication capabilities. It will enhance patient communications, and it definitely is a great direct route to patients to facilitate marketing your business. Getting started is easy. If you're interested, then we're going to send you a form. You fill out that, give us your details, and that's it. We'll incorporate that information into the app. We then provide training for you. We provide the marketing plan for you, and we go from there.